Good morning, everyone. I'm Dr. Jennifer Enns from the Manitoba Centre for Health Policy at the University of Manitoba.
And I'm Dr. Julianne Sanguins. I'm the Research Program Manager at the Health and Wellness Department at the Manitoba Metis Federation here in Winnipeg.
And we're so glad to be sharing this research study with you entitled Participation in the Boys and Girls Clubs of Winnipeg is Associated with Improved Health, Social, and Education Outcomes among Métis Children and Youth. So we'd just like to begin by situating ourselves in the place that this research is being conducted. We're located in Winnipeg in the province of Manitoba in central Canada, which is the homeland of the Métis Nation and part of the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people. And we'd like to acknowledge the elders and youth of our nations. So the research that we're going to talk about today looks at the outcomes of Métis children and youth who participate in the Boys and Girls Clubs of Winnipeg. The Boys and Girls Clubs of Winnipeg provide after-school programs for kids from kindergarten to grade 12, and their aim is to be a safe, supportive place for kids when they aren't in school. There are 12 clubs in Winnipeg. They're located across the city, generally in lower income neighborhoods. And they provide a number of different programs that include things like sports camps, music lessons, help with homework, and then for older kids, mentorship and leadership programs and job skills training.
Our research question is, what are the health and social and educational outcomes of Métis children and youth who participate in the clubs? The Métis are one of the 3 Aboriginal people in Canada that are recognized in the Constitution. The Métis arose from when the European settlers came to North America and partnered with First Nations women. From that arose a culture that was distinct and it had its own distinct language and traditions. The Manitoba Métis Federation is the government of the Métis people in Manitoba and represents a variety of cultural and political areas to support them. To be recognized as Métis in this province, you need to be able to trace your lineage back to the homeland. You need to be recognized in a contemporary Métis.
So in this study, we use data from the data repository at the Manitoba Centre for Health Policy. The data repository contains person-level data from the healthcare system, the education system, social services, and justice system, among others. And we can use it to link information on individual people across these data sets and over time. But of course, that's done in a way that doesn't identify any individual people. All of the names and addresses are stripped from those records before they ever arrive at the Manitoba Centre for Health Policy. So in this study, we linked attendance records from the Boys and Girls Clubs to the repository, and we used the Manitoba Métis Registry to build our cohort and limit it to only Métis children and youth. We formed two groups as part of that cohort. The participant group were children and youth who had participated in Boys and Girls Clubs at least once between 2005 and 2016. That group was 1,664 children and youth. And then we created a comparison group that was matched on age and school year and on postal code. So these were children who lived in the same neighborhood and were the same age as the children and youth in our participant group. And that group was 9,248 kids. So this slide shows just some descriptive data from the participant group only. On the right side of the slide, you can see that about 50% of kids first participated in Boys and Girls Club between ages 6 and 8, and then another 28% first participated between 9 and 11. Almost all the kids participated over the course of about 4 years or less. And so there's really a focus on, most of the kids attended most intensively sort of between the ages of 6 and 11, grades 1 to 5 or so. On the left side of the slide, some of our other stats tell us a little bit about what kind of home life the kids had and some of the challenges that those families might have been facing. About 91% of the participants came from families who were receiving income assistance. 67% had moms who were teens when they first started having kids. And 31% had been in out-of-home care or in care of child welfare. And finally, 64% had moms who had seen a doctor for mental health reasons. And so that's just a sort of a small piece of what kids and families might have been dealing with in their home life. Okay, so we're launching right into outcomes now. These are education outcomes. Looking at whether participating in the clubs was associated with improved academic outcomes. And so we can see that for grade 3 numeracy, along the bottom here, as the number of visits increased, the chances that kids were doing well in grade 3 numeracy also increased, most clearly for girls, which is the light blue line, but also for boys. As visits increased, they also tended to do better in grade 3 numeracy. Grade 7 student engagement is an outcome that looks at how engaged kids are in their learning in the classroom. Are they doing their homework? Are they asking questions in class? Things like that. And so here we saw more clearly for boys, the dark blue line increased as the number of visits to Boys and Girls Clubs increased. So these were the only two education outcomes amongst the ones that we could measure where we saw this positive association. We looked at reading and writing in grade 8, we looked at grade 7 math, we looked at high school graduation and a couple of other outcomes and didn't see the same trend. And I think really the reason for that is because, as we mentioned in the last slide, the kids are really participating in Boys and Girls Clubs most intensively at a younger age. And so I think having these education outcomes occur more proximally to the time that they attended is really what's affecting this association. Okay, the social outcome that we want to talk about today is justice system involvement. And so justice system involvement is a combination of 3 other variables, whether people are accused of a crime, whether people are a victim of a crime, or whether people are charged with a crime. Recognizing, of course, that those are 3 very different variables, but in our research, we have seen them correlate with each other quite strongly. And so we group them together under one variable, justice system involvement. So just looking at the top panel here, the red justice system involvement variable, this is amongst kids aged 12 to 17. What we saw when we ran the crude model for looking at risk of justice system involvement, we saw that the kids who participated in the clubs were actually at higher risk of involvement. And that seems counterintuitive, probably, but I want to just remind you of the challenges that we looked at on the descriptive data slide, showing that those kids that are attending really are facing more challenges than the comparison group. And so we think that's the reason why initially in the crude model, not factoring any of that in, that they look like they're at higher risk. So, but once we added those factors in from the descriptive slide into the model and we adjusted for number of visits to Boys and Girls Club, we see that the 2 groups don't look any different from each other. And then we saw the same thing happen amongst young people who were 18 to 24, so who've already graduated. We saw that after adjusting for how much they had participated in Boys and Girls Club and some of the other challenges they might face, there was no difference between the kids who had participated and the kids who hadn't in terms of risk of justice system involvement. You'll see a very familiar pattern also on this slide, looking at health outcomes. So just taking into account how often they had visited the Boys and Girls Club and how that compared to the comparison group, we saw that the more the youth participated in the clubs, the lower their risk of these health outcomes. So just to summarize, the descriptive data point to several challenges faced by Métis children and youth in the study. And although the Boys and Girls Clubs were not able to reach all possible kids, There was that large comparison group. They did reach kids in need of the programs, and that was clear from some of those descriptive stats. So participation was associated with improved grade 3 numeracy for boys and girls, improved grade 7 student engagement for boys only, and lower risk of youth justice system involvement, teen pregnancy, and sexually transmitted infections. And so we can sort of summarize this by saying that Boys and Girls Clubs of Winnipeg participation closed the gap between the participants and the comparison group, although the participants didn't actually see improvements much over and above the comparison group.
The Manitoba Métis Federation is aware of the challenges that our youth face. We're putting in place support such as 4-season camp to increase their cultural skills, and also leadership supports across the region to build strength, resilience, and capacity in our youth.
And just in closing, thanks very much for listening and for watching, and thanks to our many supporters and our funders of this study and our collaborators on the study team. If you have any questions or want to talk more about the findings of this study, please feel free to reach out to either myself or to Julianne. Thanks very much.